DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey there, folks. Welcome to DocTalk. I'm Dr. Dan Thompson. I'm sure glad that you joined us. We're going to have a great show today. Dr. Emily Reppert from the Veterinary Health Center at Kansas State University's College of Veterinary Medicine is my guest. We're going to talk about calf scours and how to prevent them. Stay tuned and enjoy the show.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. Emily, welcome to the show.
Thanks for having me. Glad to be here.
Folks, this is Dr. Emily Reppert. She is a DVM and she is an assistant professor here at the Kansas State College of Veterinary Medicine at Kansas State University. And we're going to talk about calf scours. You're down on the clinics. You're teaching students, seeing cases. So far, so good?
Yeah, it's going very well.
Good.
Kansas has been good to me, so glad to be here.
We're lucky to have you here on our faculty and lucky to have you here on the show. Well, let's talk about calf scours, and you know, as we were preparing for the show, we were talking about different things that cause calf scours. So what are some of the big buckets that you put them in, and then maybe we'll get into those buckets and talk about the different pathogens.
Sure. So when we're teaching students, talking with clients, working with other veterinarians, there's really kind of four big categories that we can break diarrhea down into. So first one is there's a handful of different bacterial organisms that can cause calf scours. There's also some viruses that are responsible for causing diarrhea, and then also some parasites. And then finally, one that I think we oftentimes miss, and that is the nutritional category. So associated with milk replacers, oral rehydration therapy, that sort of thing.
Sure. So what are your common bacteria that would cause these types of issues or the calf scours?
So I would say the most common bacterial organism that we see with diarrhea in young calves is going to be E. coli.
Sure.
Another one, not as common, but one we also see would be Salmonella. Mm-hmm. And those probably are our two real big bacterial organisms, and then every once in a while Clostridial bacterium as well.
Right. And then on the viral side, we have a couple of
big heavy hitters. So certainly rotavirus and coronavirus would be up high on my list. I think BVD as well, but far and away the more common in young calves is going to be rota and coronavirus.
Okay, and then we're going to let's move into the parasitics. I think most people, the E. coli, the Salmonella, the rotas, the coronas, most people are pretty well heard of those, but maybe some of these other two, like the parasites and that, are not as common. And
Sure, and I think probably our dairy population of people out there are maybe more familiar with these organisms. So Cryptosporidium, that's a fairly common one in that production system, and then certainly Coccidia would be another one that we see.
Sure. Let's move into the nutritional components, because that one kind of, we seem to be a bug drug disease community, but what are some of the nutritional components you see with diarrhea?
So I think probably the most common time that we see it is associated with overfeeding of milk replacer. So oftentimes associated with bottle babies that are either being fed too much milk or being fed milk replacer that has been inappropriately reconstituted, so at a higher concentration than it needs to be. So those are kind of the two times when we see sort of a nutritional type diarrhea.
Cool. Well, you did a great job of setting us up for the rest of the show. We're glad that you're here. We're glad that you're watching DocTalk. When we come back, we're going to talk more about prevention of calf scours with Dr. Emily Reppert. We're sure glad you joined us.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Peter Strasberg was recently awarded an Amstutz Scholarship. Growing up in Wisconsin, he spent a lot of time on a relative's dairy, and from then on, Peter has worked in one aspect or another of the dairy industry. His interests include reproductive physiology, cattle comfort, and herd level management. After graduation, Peter hopes to join a predominantly dairy cattle practice.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multacida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Emily Reppert from Kansas State University's College of Veterinary Medicine, where she is an assistant professor in the Ag Practices section at the Veterinary Health Center. So many different breakdowns of where you're located, but in other words, she's on the clinic, she's teaching our students, she's working with clients, she's seeing cases, she's a real veterinarian, and we're tickled to death to have her here on the show. You know, as we move through this calf scours and working with the situation, what are some of the things in general? Just kind of go through some of the classic situations as far as timing and clinical signs and things like that we might see if we're going to have this problem on our farm.
Sure. So I think one way at least that we teach kind of the different organisms that can cause diarrhea is by when they typically occur. So when we're talking about our bacterial organisms, certainly E. coli associated diarrhea is typically going to be the organism that we most commonly see in calves that are 1 up to maybe 3 days of age. I think it's important to realize that, you know, oftentimes it's not just one organism that's causing the diarrhea. So sometimes they can have a bacteria and a virus infecting them at the same time, which can kind of complicate the situation there. So then when we're talking about our viral causes, so rota and coronavirus, those we're going to typically see within, you know, the first 1 to 2 weeks of age. And then in the classic situation, our parasitic causes usually we see those in older animals, so 3 months with coccidia. Usually that's associated with calves that are at the time of weaning or even transport to the feedlot, that sort of thing. The clinical signs that we often see with young calves is usually diarrhea within the first week of age. Depending upon the organism, there may or may not be some blood associated with it, but oftentimes it's sort of that yellow, watery diarrhea. And depending upon how long they've had the diarrhea, they may or may not be depressed. They may lose their suckle, may not want to, keep up with the dam, that sort of thing. But those are kind of the big things that we typically see.
What are some of the more
field.
dangerous things associated? I'm assuming dehydration, and that is something that septicemia and dehydration are two things that are common or very dangerous to the calf.
Yeah, so probably our biggest concern certainly initially is going to be our dehydration, especially if the diarrhea is very, very watery and kind of large volume. Dehydration definitely is an issue and something that would need to be addressed. And then on top of that is anytime you have diarrhea, it's associated with inflammation of the GI tract, and that sets up the perfect scenario for bacteria to get into the blood and potentially affect other parts of the animal, whether that be go on to have a naval infection, joint infection, that sort of thing.
Cool. Well, let's take a break. We've got bacteria up front, viruses in the middle, parasites towards the end, different clinical signs, and get on it as soon as possible.
Exactly.
All right, well, we're going to take a break, folks. When we come back, more with Dr. Emily Reppert on preventing calf scours.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Calves require adequate, high-quality colostrum immediately following birth to receive the immune and nutritional support needed to fight diseases and thrive. Next-generation Colostrix colostrum replacer and supplement are USDA licensed to aid in the treatment of failure of passive transfer and contain natural maternal bovine colostrum antibodies against E. coli K99. Ask your animal health supplier for Colostrix or visit agrilabs.com for details. Colostrix makes all systems go.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
TrueTest Group, weighing systems, electronic identification, EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Emily Reppert, where she is a veterinarian at the Veterinary Health Center in the Ag Practices section here at Kansas State University's College of Veterinary Medicine, and we're talking about calf scours, and we're going to jump right into prevention. Emily, and when we talk about prevention, the first thing that pops in your mind is that colostrum, right?
Yep, absolutely. That's critical to neonatal calf health. making sure that they have adequate passive transfer.
So colostrum is that first milking, not the second milking, not the third milking, because you have a complete drop-off after that first milking as far as the immunoglobulins and the immune status. But, you know, how do I select which animal, if I'm going to get colostrum to freeze on the farm, which animal am I going to be selecting?
So, you know, we know that heifers tend to not produce as large a volume and typically lower quality colostrum than adult animals. And so if we were going to have a colostrum bank, we would want it to be colostrum from, you know, cows that we know produce a high volume, so our older animals in the herd, ones that have been, you know, well vaccinated, which I think we'll touch on in a minute. And then also, I think it's important to, if we have the capability, to pasteurize that colostrum so that we're not, you know, freezing and then feeding bugs to our babies. So certainly, I think, you know, the adult animals would be the ones that we would really be targeting for our colostrum bank.
Cool. And you know, as far as colostrum and when you feed it, you know, what's the recommendation on how soon or how long can you still add colostrum, or when do we want to get to that calf?
Sure. So the calf needs to, you know, for maximum absorption of all of the good stuff that comes with the colostrum, they need to receive that within the first 24 hours. And we like to see them get, you know, 20% of their body weight in colostrum, you know, total volume over that 24-hour period. That's
so 20%. So a 100-pound calf would get 20 pounds.
Yep.
And let's see. So 8 pounds. So a little under 3 gallons.
Yep.
For a 100-pound calf. That'd be good. So get the colostrum from an adult animal. Get it in the calf as soon as possible, and 20% of its body weight over 24 hours. That's pretty good information for our viewers. When we start talking about colostrum, one of the things, you know, hyper-immunizing cows or just immunizing cows, you know, are there things that we can vaccinate for in the dam before she gives birth for the calves that are going to suckle, or for calves that we're going to have the colostrum bank for?
Yeah, absolutely. And so I think one of those things would be specifically for some of these viral organisms associated with calf scours. And so there are a handful of different vaccines that are labeled just for that purpose. And so that'd be a great way to interact with your local veterinarian, kind of working out a vaccinations, you know, schedule, but definitely, especially for the viral organisms,
the rota and the corona.
Our rota, corona, that would be something that I would, in some herds, it's very helpful.
Okay. Cool. And I know some of the dairy herds are using some of the salmonella vaccines and some of the E. coli, but salmonella can also be something that's septic in adult cattle as well.
Correct. Yep.
Cool.
Yeah.
Well, let's take a break. When we come back, we're going to finish up with prevention of calf scours with Dr. Emily Reppert. Thanks for joining us.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
I'm Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation. Today's tip, we're going to talk about accurate dosing of cattle as we process or work our cows and calves. It's very important that we dose them accurately. How many times do you set your automatic dosing gun for your wormer? Just set it on a flat 60 and process your cows. I would suggest or recognize that we actually ought to take a more accurate approach with the weight and dose it up and down accordingly. We could be overdosing, we could be underdosing. Underdosing, as we know, leads to resistance. Overdosing reduces efficiency. So the most accurate way is to bring them in the chute, have a scale head, collect a weight, and dose them accordingly. If you don't have a scale head, I would suggest that you could get one. I promise you it will pay for itself over time.
It must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. but it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
Working your cattle just got easier. Introducing the new Vet Gun delivery system, a new way to apply topical insecticides to your cattle. The Vet Gun lets you remotely treat cattle with effective parasite control, so you can do it from an ATV, on horseback, or just walking among the herd. It's that simple. The proven topical insecticide AML Vet Cap is used with the Vet Gun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. Vet Gun. Check with your animal health supplier for availability.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with my guest, Dr. Emily Reppert, who's a DVM and is an assistant professor in the Clinical Sciences Department at the Veterinary Health Center at Kansas State University's College of Veterinary Medicine. And we've been talking about calf scours, prevention, and one of the things we talked about during the break is, we talked about vaccinating the dams, but actually maybe in the face of an outbreak, vaccinating some of the calves with those viral vaccines can stimulate some immune response as well.
Yeah, so the idea being sort of a local immune response within the GI tract itself. And so, again, that would be something that you would want to work with your local veterinarian on, but because those vaccines have to be administered prior to administration of colostrum in some instances.
Okay.
But if you have a known problem, on your herd with one of those viral organisms, it would be something to look into for sure.
Cool. Well, let's talk about environment, because we've talked about the calf, we've talked about the colostrum, we've talked about the vaccination and priming that immune system, but that biosecurity or that disease pattern, host, environment, and pathogen, we really need to talk about environment.
Yeah, all the prevention in the world is not going to do us anything if we're putting these calves into a really contaminated area. Certainly I think separation of different ages of calves, and certainly calves from heifers versus calves from cows. If you have the geographic space, I think it's good to try to kind of keep the age groups together so we don't have day-old calves commingling with 2-week-old calves, that sort of thing. The other thing I think that sometimes we don't think about necessarily would be, we think we have adequate pasture space for our cows and calves, but it seems like a lot of times we'll have everybody kind of congregating around where they feed or where they water, so making sure that we move our hay bales or, that sort of thing.
Having all the space in the world is one thing, but if you keep putting the feed and the water in one spot, and specifically the hay bales, dry, keeping those calves dry, keeping them warm.
Yep.
Very important, I assume.
Yep, and making sure that they have access to all the clean, fresh water that they want is also really important.
Cool. And then let's wrap up, because we have just a little bit of time here, but these pathogens can cause disease in humans as well.
Absolutely. So I think that that's something that's really important, especially when we're bringing those calves inside to warm them up. Certainly salmonella, crypto, all of those can be zoonotic, and so just trying to do appropriate biosecurity ourselves, making sure we wash our hands, all of those sorts of things.
And keep young children and pregnant females and people that can be immunosuppressed away.
Yeah, away from those.
Cool.
So.
Well, thanks so much for being on the show.
Yeah, thanks for having me.
It's great to have you folks. Dr. Emily Reppert. Thank you for watching DocTalk. Remember, always work with your local veterinarian, and if you want to find out more about what Dr. Reppert and I do here at K-State, you can find us on the web at www.vet.ksu.edu. You've been watching DocTalk today. We're sure glad you joined us. I'm Dr. Dan Thompson, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.